Finally, just want to spend a little bit of time talking about the situation with the infected cattery. This is really the big problem. You know, if you want to scare a cattery owner, just say the word ringworm, because to get ringworm is a real disaster, be it in a boarding cattery or in a breeding cattery. And really, this can be a financial disaster. It can cost many thousands of pounds to really sort this problem out. If you don't do the problem, if you don't go through things properly, it's likely that you will never quite sort the problem out, and there'll always be a low level of infection. So you have to really have very committed owners, and certainly Doug DeBoer and Karen Moriello, who have done a lot of this work 10, 15 years ago, would quite often talk about euthanasia and just closing a place down because the problem just could not be got rid of. And of course, we've all seen kittens being sold by breeders who probably know that they've got dermatophytosis in their cattery, and they're just exporting problems to other people, and it's just not fair. So we have a duty, I think, to really do this thoroughly. Obviously, we need to have very motivated clients, and if they're not motivated, then don't make too many promises. I think where we really see these problems is in the pedigree catteries, people breeding Persians, breeding Himalayans. You know, it is a problem. They go off to shows. Sometimes the hygiene there is not as good as it should be, although it's obviously improved a lot over the last 10 years. And they can bring stuff in, and then of course we have problems. So as an aside, it's not been mentioned on here, for people who are showing a lot, it is well worth, if they have a particular animal that they are showing a lot, to consider keeping him or her in isolation during the showing season and regularly having him cultured. Because some cats, you know, I've certainly seen Persian cats who haven't got anything obvious on them, but you put a woods lamp on them and they glow. So it can be something that they carry that nobody's really aware of until perhaps a human or another cat starts to develop lesions, and we look to the Persians and the Himalayas as the carriers of that particular problem. So in a situation where you know that you've got one or two cats with ringworm in a cattery, the first piece of news that I would give the client is, if one or two have got it, unless you are being very thorough and you're having them in completely separate areas, the likelihood is that they all have it, because you're going in the same clothes, you're probably carrying ringworm into the next kennel, you're helping to spread the infection. So if two or three cats are infected in a cattery, presume that they all are. And what I would usually do in that situation is perform cultures on all the cats. Send them off or do them in-house if you feel comfortable doing that. And if after the 2 or 3 weeks you get some samples back and there are cats that do not have M. canis, then separate those, isolate them, but reculture, because unfortunately in the 2 or 3 weeks that you've been waiting for your result, it's very possible that they have become infected with M. canis. I think you have to isolate the cattery. You have to practice very, very good hygiene, changing out of clothes if necessary, certainly disinfecting, shoes and so on as you're walking in and out of places, and certainly putting a stop to people coming into the cattery, new cats coming in if it's a boarding kennel, and certainly stopping showing at shows if you know that you have an M. canis problem in your cattery. I think if you want to really get rid of the problem quickly, and time is money, and we know that itrafungal is not a cheap product to use, then I think it is well worth getting a couple of the nurses into the cattery, because that of course stops them bringing their infection into the surgery, and with some Domitor and Torbigesic going around sedating the cats and clipping them pretty short. I mean, if you clip them very, very short, of course you can cut them, and of course that can then allow dermatophytes to get into the skin more. So you may not want to use the very short blade, but you want to clip them back reasonably aggressively, and think about using your enylconazole washers, or perhaps Malaseb. Malaseb has also been used in those situations. Itraconazole used on all the animals as per the instructions, so a week on, a week off, a week on, a week off, a week on, a week off. And I would have thought at about the 4 to 6 week period, you do a culture of all of those cats for a fungal culture. If you have negative dermatophytes, I would remove them from the infected area and I would treat probably for another couple of cycles. So, certainly although it's recognized that you do it for 3 cycles, there is no problem for doing it perhaps for a 4th one. In the meantime, while all of that is happening, you're obviously treating the environment very thoroughly. Enilconazole can be used on the environment, as can bleach. Obviously, you need to make sure that you're not going to bleach an expensive sofa or an expensive carpet, but you should be treating the environment regularly and thoroughly, hoovering, getting rid of the bags, spraying the areas that carpets, curtains, washing things thoroughly, perhaps getting a carpet cleaner in to really give them a good going over when you've done that several times. And we wait until we get negative cultures. And once we have negative cultures for everybody, we can say that this cattery is now open for business again. But you can be taking certainly 2 to 3 months and many hundreds, if not thousands of pounds, depending on the number of cats, to sort this problem out. So it is not a problem to be tackled lightly or for the faint-hearted. It is one of those words, as I say, dermatophytosis in a cattery, which strikes fear into cat lovers' hearts. I think that's all I want to say at the moment.